Are you looking for a way to iron out the wrinkles that have come with sun damage and age? Botox is one of the most popular treatments women turn to for a more youthful look. Dr. Brandith Irwin is the author of The Surgery-Free Makeover, All You Need to Know for Great Skin and a Younger Face. And when it comes to Botox, you've probably heard so many of your friends getting this procedure. Maybe you've had it. But there is good Botox, there is bad Botox, right? As far as the procedures go.
Exactly. There's a big difference between the great, the good, and the ugly.
Okay,
so
so
be honest.
So what do we need to know when it comes to Botox? What do we use it for? What's it being? Is it for the eyes? Is it for other areas of the face?
Right. It is perfect for muscles that are overactive in the face. So if you have that, a frown line that really wants to scrunch right there.
I think I've got it.
It's perfect for that.
Okay.
And many women know that already. And around the eyes, I think it was perfect for that, again, because our muscles, when we smile, scrunch that area. And I think, but what many women don't know is that we do not need to look like we have a frozen face. Sometimes I call it the Oscar night freeze.
And that's one thing I wanted to ask you about, because we see a lot of actors and other people who have had Botox done, and it's as if their face doesn't even move. Is that considered bad Botox?
Well, it is in my opinion, because in my opinion, good Botox should be almost undetectable. In other words, the face should still move. And I tell my patients the goal, in my mind, is no wrinkles, not no movement.
Okay.
Because a child's face has no wrinkles, but it has movement. And so when I start to see it, I think it's over-Botoxing to have a face that looks blank and expressionless.
So what do patients want to look for when because there are so many places now, med spas offer it. You can sometimes find it, at sports clubs. You can have all of these spa services that offer Botox. How do you go about finding somebody and knowing that you're going to get a procedure that's done right?
Right, so what you want is an expert injector, right? Not someone who is I think one thing to look for is look for a doctor or a nurse or other provider who's supervised a doctor who's been doing it for a long time. Because I think there is a learning curve like anything else. So if you've gone to a one-day course at the company, you won't have the same skills as someone who's doing it for 15 years. And so look for the people who are experienced, who've been in the community, have roots in their community, feel responsible to the community, and those are the people that are likely to be really good at what they're doing. And then I think ask your friends, but they're not always the best resource because, again, look at how they look, that might not be a good thing.
So you want to make sure there's, as you said, just to recap, a little bit of movement. You don't want that frozen face look. So when you talk to your friends, see what their results have been
Right,
like.
because I have a little bit of Botox, but when I smile, I have curls. You can
Let's
see.
have you look at this camera right over here. See, and tell people your age just so they know.
I'm 55.
Unbelievable. She looks gorgeous.
My forehead moves. I can still raise my eyebrows. I can smile, and I have some movement around my eyes. It can be done with a very light touch. And I think another thing is, on our website, skintour.com, there's a consumer guide which helps you learn to know what is good Botox and what is bad Botox. So that's a good resource too.
So very important. The book is The Surgery-Free Makeover. Dr. Brandith Irwin is a cosmetic dermatologist. Thank you so much. Great information. You're going to find loads of it.
Thank you for watching Better.tv. Please email us your thoughts, ideas at Better.tv. Together we'll make your home, family, and life better.